Hello, I'm Azita Arvani of the Arvani Group, Mobile and Wireless Strategy Consultants. We are here at the CTIA show in San Francisco, where I'm sharing the mobile health devices panel discussion. I have with me a panel expert, Jim Pursley of GE Healthcare. Jim is the General Manager of Sales and Marketing for GE Healthcare Aging Services. Jim, thanks a lot for being here today.
It's my pleasure.
Great. I know your work focuses on helping senior citizens live safely and independently.
Correct.
So why is GE Healthcare focusing on the elderly population?
If you look at the demographics, the aging population, the Silver Tsunami as they call it, you look at the cost of delivering healthcare in an acute setting versus a lower acuity setting. You look at the shortage of caregivers as the aging population, the demographics skew in that direction, and it's a huge opportunity. It's whether it's driven by those demographics, the economics, or simply consumer choice and preference. People want to age independently in their home. It's the right thing for the healthcare system. It's the right thing for the payers, the providers, and ultimately it's the right thing for people. So it makes sense, and now's the time.
Great. Now, what are some of the short-term opportunities that you think can help the elderly with living independently and safely?
Aging well is a multifaceted challenge. There's safety and wellness, security. There's cognitive health. There's social interaction and connectivity, social health. Really, I think mobile health and mobile health devices can impact really all three of those areas and more. Specifically, though, we're looking at how does mobile health help with the social connectivity piece? How do we connect caregivers, family members, the oldest daughter, a physician? How do we bring them together in a meaningful way that promotes vibrant social health? And then also, how do we use mobile devices to empower a senior to be more mobile, not having to sacrifice safety and security? So can you give them devices that can travel with them, whether it's through cellular or through satellite, that can empower them to live life on their terms, but still have the safety and security and technology they need, whether it's a personal emergency response system or some way to connect with their oldest daughter.
Okay. Notice he said the oldest daughter.
It tends to skew that way.
Right.
Sons can also be caregivers, but it tends to skew towards the oldest daughter.
Right. I totally understand. So when you think about the aging population, you don't really think of technology early adopters.
Correct.
So what are some of the implications of that when it comes to doing mHealth devices for the senior population?
Well, that's just right. The aging population typically is not the consumer of the technology. It's usually the daughter or the son, the oldest, the child, who is purchasing for mom or dad.
Right.
They're either the economic buyer or they're the strong influencer. But either way, they're going to play a large role in the proliferation of mHealth devices for seniors today.
Right.
Now that will change, we think, as the boomer population starts to move into their 70s and 80s. This is a generation that's comfortable with technology, that has iPhones and iPads and cell phones. They'll probably be the consumers of their own healthcare devices. But today, it's the daughter, the son, who's purchasing the technology for mom and dad. So that's really who the messaging, the targeting, the marketing, the value proposition is geared for today.
Right. Well, Jim, thank you so much for being with us today.
Thank you for having me. It was a pleasure.
Very, very helpful.
I look forward to our discussion later today.
Great, thanks. I'm Azita Arvani of the Arvani Group. We are a business consulting firm that specializes in helping companies that want to develop and execute their mobile and wireless strategies. For more on my discussion with Jim and the rest of our mHealth series, check out arvanigroup.com. Thanks for watching and be well.